Hello, I'm Malembe Ebama, and I'm the director of a task force program that helps countries in Africa and Asia build early warning surveillance systems to respond to outbreaks. I'll tell you a bit about that in a minute, but I want to start with something else. Dr. Faggy shared earlier that the 1990 UN Summit for Children was a high point in his life. It was for me too. I was one of the children representing the countries of the world. I was 12 years old, and I represented my country, Zaire, now known as the Democratic Republic of the Congo. I wore a beautiful green dress of traditional fabric, and I escorted the Zairean Prime Minister to his seat in the United Nations Gallery. I didn't know then the full significance of that event, but I did know that what I wanted to do when I grew up was having a job that would allow me to help others. So you won't be surprised to hear that seeing the movie Outbreak in high school had a huge impact on my decision to follow public health. Watching those heroic doctors, Dustin Hoffman, Rene Russo, race to find a cure for a deadly virus was an aha moment for me. There was an actual job where you could be a virus hunter, and I thought, okay, this is it. I wanted to solve those types of problems. So fast forward to several years later, after I've earned an MPH and a doctorate and was an official epidemiologist, I joined a task force and I've never looked back. Although my job title isn't virus hunter, it's just as exciting to me. The program that I lead, which is called SONAR, involves colleagues from several task force teams who have expertise in epidemiology, public health informatics, and building immunization systems. Together, we're helping 14 countries in Africa and Asia strengthen their surveillance systems to be better prepared for the next pandemic. To put it in simpler terms, you can picture it like the old-fashioned bucket brigades that would put out fires, with everyone from the person at the source of the fire to the person at the farthest end of the chain with the first bucket of water, knowing what they need to do and being ready to do it. We work with ministries of health and other partners to ensure that their approaches are coordinated at every step in the chain. This involves a lot of people. We bring together experts in human health, animal health, and environmental health, the private sector, pharmacies, educators, health clinic staff and patients, and many others. And we coordinate with the World Health Organization and Africa CDC to align all the pieces, so that if someone in a community sees multiple people with unusual symptoms like vomiting or abnormal bleeding, they know what to do and who to call. And then that next person knows what to do and who to call. And the chain works, all the way from the most remote area to the national level. But the part that is most exciting to me is the pride and ownership of our partners who are leading this work in their countries. When they report out from Sierra Leone or Nigeria or Madagascar that the Minister of Health has endorsed this plan, or this month we trained this number of people, I'm able to see the momentum and progress happening in real time. And this is taking place in multiple countries around the world. So just as Dr. Faggy said, he looks back on that 1990 summit as a pivotal moment in child health that shaped the decades to follow. I believe that someday we'll look back at this post-pandemic era and the work happening now and realize that this too was a turning point. Thank you, Dr. Faggy, for setting a high bar for all of us who work in public health. And thank you all for your partnership as we work to ensure a world where people have access to systems and services that lead to healthy lives. Thank you.